Together with the Zero Malaria Campaign Coalition and the National Malaria Control Program, together with the Ministry of Health, we're here at the Devolution Conference to raise awareness around the seriousness of malaria, and very importantly to share information with the public and the participants around malaria, which is one of the oldest and deadliest diseases. It is important for us to take note of the progress that has been made so far. Between 2010 and 2020, we reduced malaria in Kenya by 50%. And as we know, COVID had a major impact across the world, and Kenya included. So there was a slowing down of the progress that was being made, which sort of brings us to the point why we are here today, because we really need to focus attention to action at the local level. This afternoon, the President spoke about the importance of focusing on the lowest political units, the wards, which of course are within counties. So it's really important that we focus on primary health care as a place where we start to action provision of health services. The other reason why it's important for us to be here is because of the public engagement. As you will see behind me, we talk about zero malaria starting with me, which means that every single person has a role and a responsibility to take action to prevent and control malaria. So that's the reason why we are here today. Thank you.
Do you foresee a country with zero malaria in the next years?
Absolutely. I mean, the vision that Kenya has is a country that is free of malaria. So the way to get there is to make sure that we are applying all the tools and the innovations that we have, and we are making sure that people have access to prevention, such as making sure that people are sleeping under mosquito nets, that we're doing spraying to make sure that we are getting rid of the mosquitoes, and very importantly, that people get diagnosed. If somebody is running fevers, they go to a hospital, they can get tested, and then get on their treatment, stay on their treatment so that they do not build resistance. And that would lead us to the point where we are a country that is free of malaria. So for me, I would urge people to sign up, get engaged, educate themselves, and be informed and commit to ending malaria in our generation.
So maybe just a nutshell, what should people do?
Yeah, as I said, because we're at the Devolution Conference, we do know that health services are being provided at the county level. What this means is that somebody can get services at the health facility that is nearest to them, which means they can get tested for malaria. But before they even go to get tested for malaria, the important steps that they need to take is to sleep under a mosquito net. That's very important. And they also need to make sure that they're taking care of their environment, so that they're clearing bushes and spaces where where mosquitoes are breeding. And then once they have taken those steps, and if by any chance they are running fevers, then they need to check and test if they actually have malaria. So do not assume that it's malaria or it's not malaria. Actually get a test, and once it's confirmed that you have malaria, get the treatment.